A physical disability is a limitation on a person's physical functioning and mobility. Physical disabilities, whether temporary or permanent, no matter the degree or whether they are visible to the eye or not, affect people's daily work and school lives dramatically. People with physical disabilities are often hospitalized at one point and then continue to have complications throughout the rest of their lives, and this can be a huge obstacle in a person's school and work life. Scoliosis is a disability that I personally have a lot of experience with. Scoliosis means curvature of the spine, and it is most common in teen girls like me. Scoliosis screenings normally would take place at middle schools throughout a couple PE periods. Every child was thoroughly checked for this possible chronic deformity. Children suspected to have abnormalities were referred to a doctor for further checkups. However, the state scoliosis screening mandate and reimbursement was suspended in 2010, and it is uncertain whether it will be reinstated at a later time. This testing is crucial and should not be suspended for middle schools because scoliosis is commonly developed in teen years, and if the spinal curve keeps progressing, it can lead to noticeable physical deformity, pain, emotional distress, and possibly organ damage. However, with scoliosis screenings, this could be caught sooner and patients could avoid further harmful health outcomes and maybe even surgery. And I'm not the only one with this opinion.
The fact that you just told me before we started filming that they don't do that anymore is really quite shocking to me. And as soon as we're done here, I'm definitely going to do some research because it's extremely important for that kind of service to be offered at our public schools. When I was at the middle school, we would have the nurse come in, and we just assisted in terms of getting kids in order, organized, but we didn't do any of the official testing. We did have the nurse come. So the fact that that service isn't being offered, some kids' diagnosis may go undetected for several years depending on how accessible they have to health care on their own. So the beauty of having it in the public school system and having it incorporated in the school day made sure that every single student was able to be properly assessed. So it kind of worries me, and I'm definitely curious as to why they've stopped doing that. So sad new news to me.
Personally, I don't work at the middle schools, but I do think that it was a good thing that they did do it. You know, we didn't often find people that had scoliosis or that it was suspected, but it was that opportunity to make people aware of it and maybe get them off to the doctor when, if it's just slight, they might not notice it themselves and the doctor might not even notice it. So I think it was a worthwhile 2 days maybe that the school nurse had to spend over there doing it because it did make people more aware of it going on.
I think it should be done. I remember back when I was in junior high school, again, we're talking 40 years ago, they were doing the screening in junior high, and a lot of people were identified with scoliosis and needing to have further follow-up. So I think that it's a vitally important part that should be included in a PE class situation so that students that are going through it can get identified earlier to be able to track scoliosis.
Much like me, people with physical disabilities have a hard time keeping up with their education. 2 years ago, I was diagnosed with scoliosis. The pain started to grow little by little, and after a few months, it got unbearable and I started to go to the nurse and call home all the time. My parents and I wanted to wait until summer break for my surgery, as we were concerned about me missing a big chunk of school. But sadly, since we don't have screenings anymore in middle school, this disorder wasn't discovered sooner, and I had to have surgery as soon as possible. So we had decided on a sooner date. To try to miss as little school as I could, I had my surgery December 14th, 2015, the week before winter break. I got some finals done early and made plans to make the rest up along with most of my classwork I missed after I came back. Recovery time for scoliosis is an estimated 6 weeks. I spent 1 week in the hospital recovering, learning how to sit and walk with my back at new angles, and after that I spent the rest of the break and some added time out of school recovering at home. I was happy to be out of the house and have enough strength to participate in school again. However, when I came back, I was overwhelmed with all the work I had missed and had to make up. I was prepared for this and had come to an understanding with all my teachers regarding making up this work before I left. However, some teachers didn't keep their word, and on top of finishing last semester's finals and getting those grades back up, I came in the middle of projects and class activities I knew nothing about. I struggled a lot through the next semester and barely passed all my classes. And after returning to school, I wasn't recovered and just back to normal. I couldn't participate in PE. I had to miss class to go to physical therapy appointments. I continue to have pain and leave early, especially during the colder months. My back tightens up and feels worse. And the plastic school chairs become hard to sit in as the day goes on. Some days I debate whether to come to school or not because I'm afraid it will be too painful to focus, but I have to come to stay on track. I can't take regular PE. I take low impact, and luckily my teacher is very understanding when something is too painful for me. We come up with modifications, or I can sit out for that part with no penalty. I still struggle. It's hard for most people to understand because I look fine on the outside, but some days I can't even move my back to get out of bed in the morning. This causes me to miss school and struggle to make up work to get back on track. This is Gina. She has been a huge inspiration to me throughout the years I've known her, and has been so uplifting helping me through pre and post surgery. Now let's hear her story. I think she will be an inspiration to you too.
I was injured in a diving accident when I was 14 years old. I dove into the shallow end of a swimming pool and I broke my neck and ended up with a spinal cord injury at C4-5, which is the cervical vertebrae, at the fourth and fifth vertebrae. Rehabilitation back, now we're talking 40 years ago. Education in schools, it was mandated, Section 504 is providing educational experiences with the least restrictive environment. So it's really trying to accommodate students in the same settings. And when I was in rehab, I ended up in the hospital for about 9 months. So that was my whole freshman year. And I ended up having to do home study for that time. So when I came back, I came to school as a sophomore. I am an adaptive sports consultant here at Kaiser Foundation Rehabilitation Center here in Vallejo. I was an adapted PE teacher for 20 years at a community college. And what got me started in that was when I graduated from high school and went to junior college, I enrolled in an adaptive PE class, which is the class that provides physical education and movement, adapted aquatics for people with disabilities. And that got me inspired to get back to swimming, and I found out about all these other adaptive sports for people with disabilities and got involved that way. Aside from everyone thinking that either I'm a patient here, just well-dressed, or that for some reason that I volunteer my time as opposed to being a paid person on staff. And I'm not really sure why that those kinds of societal attitudes kind of seem to be really prevalent in people with disabilities don't have jobs, or those kinds of things, which isn't the case. Well, when I was in high school, some of the things, there wasn't the Americans with Disabilities Act, so there was no mandates on accessibility as far as elevators or accessibility for a bathroom. And that was one of the issues that I had, was needing to have a bathroom available. And one of the buildings, it was actually up in the teacher's lounge, that had a large enough stall. So they installed grab bars so I could use that one. But when I was ready to go to school, they, meaning the administration, wanted to send me off to the special school for students with disabilities. And I was really reluctant to do that. I wanted to be with my classmates. And just because I have a mobility impairment does not mean that I have a cognitive impairment. And I was able to keep up with my classmates and be able to graduate at the same time. But to answer your question regarding elevators and access, I've experienced quite a bit over 40 years of lack of accessibility. It's gotten much better over the years, but there's still a lack of education or understanding on how to interpret what is written in the ADA, Americans with Disabilities Act. Well, there's quite a bit of modifications, adaptations that I need to use just to get through my morning and getting dressed and making sure that I've got everything within reach and accessible. And as I'm getting older, kind of doing more energy conservation and expending the energy when it really needs to be spent, so then I can get through my day and be able to take care of myself at night. So it's having modifications in my van, making modifications to my wheelchair. I think some of the things that I encourage just our patients here that are new, acquired a disability, is getting connected up with support groups and talking with people that have similar disabilities or abilities. Just because then you don't feel so alone, and you're not the only person going through this and experiencing it. And sometimes being able to share how I do something with someone else might help them problem solve how to do something and be able to modify that so they'd be able to accomplish whatever tasks they're doing. I encourage people to, when you meet someone with a disability, and kind of not shy away from that, but if somebody looks like they're engaging or want to be engaged in a conversation, I think we all become more enlightened when we reach out to somebody that we don't know or someone that is different from us, and being able to gain more insight into that. I think that that's a really beneficial way to help kind of continue awareness. And there's a lot of different exhibits that are going on that are at the Ed Roberts Center, and there's an art exhibition at the Academy of Arts in San Francisco over the summer on disability awareness. So it's like those are places where I think people can really learn a lot.
Jana feels strongly about Section 504 of the Rehabilitation Act. Passed in 1974, this is the act of providing education for people with disabilities in the least restrictive environment possible. LRE, or least restrictive environment, is the requirement in federal law that students with disabilities receive their education to the maximum extent appropriate with non-disabled peers, and that special education students are not removed from regular classes unless, even with supplemental aids and services, because education in regular classes cannot be achieved acceptably.